us talk about SMP Made Easy. Some tips and tricks. There's no conflict of interest. SMP Synth has now gained a well-established reputation of a useful technique in the armamentarium of hair restoration practice. So just a quick review for tips and tricks so that you can establish SMP in your clinical practice easily. You can face the challenges and you know the step-by-step easy methodology of how to do it. First thing first, we have to take a detailed consent for SMP. Next come the tools. The tools should be pigments. There can be many pigments like organic, inorganic, but mainly you should use organic, which are carbon-based pigments. They should be sterile. Needles should be usually tri-cannulated. You may use single cannulated at times, but then there are different times to it. Then the needle should have a membrane so that there is no cross-contamination between patients. The machine should be a minimum noise machine, that means minimum vibration. Needle cycling should be between 100 to 150 cycles per second. How to decide the hue of SMP ink? So you should choose the shade that works best to decrease the contrast between the color of the scalp and hair. And this ink should emulate the color and look for natural hair follicles. How to make the desired color, the desired hue for SMP patient? Different providers have different color charts of making the desired color. You have to use distilled water or bottled water as it is required in a particular ratio. Proper mixing. And then this is just to show the SMP workstation, a proper machine, pigments, needles, etc. A few tips now. The visual effect of dots is created. The number of SMP dots do not allow 1 mm distance patterns. So the total number of SMP dots will not actually depend upon the area of scalp, curvature, etc. The mechanics, ideally, the ink should reach the upper dermis, that is the papillary dermis, and the depth of the needle is adjusted by the feel while doing and visual judgment. If you place too deep in the epidermis, the pigment will leak out, which is called bleeding of ink. If it is very superficial, it will leak out within a few days. The needle size and cannulation is very important. The normal skin, scar tissue, atrophic skin, every skin can retain the ink in a different way. Approximately 3 sessions are required. The first one is called foundation, second is building, and the third is decoration. So this is how we teach and this is how we do and tell the patients also. Oily skins tend to throw the pigments out very soon, so that you may need several sessions, even up to 7. But oily skin retains better than dry skin. Before we end, we should pay attention to hairline design with as much precision as we do in hair transplant. And we should always consider future hair loss. In summary, just your ink, needle and machine should be organic, tri or low noise. Prepare the shade of ink carefully. For the first session, darkness should be equal to darkness of hair, and then you should tweak in next sessions. Depth commonly between 0.5 to 1 millimeter. Avoid 3 excessive Ps, pressure, pause, and packing densely to avoid blotching. Thank you so much.
Thank you very much, Dr. Saraswat. And our next speaker is Dr. Lee from South Korea with scalp micropigmentation, retouching for better results.
Hello, I'm Injeri from South Korea. I'd like to discuss SMP retouching for achieving better results, much like the pictures you see. Retouching comes in 2 forms. Retouch A, this is done from 2 to 6 weeks after the initial procedure, a more familiar concept. Retouch B is performed during the initial procedure using a from 2 to 3 pass concept. During SMP, we put pigment into the scalp, creating small dots. The amount and depth of pigment affect the dots' color, size, and longevity. Research A is necessary as expecting perfect results after a single session is unrealistic. Sometimes it takes multiple sessions, up to 5, due to shallow needle insertion or insufficient pigment. For areas inadequately treated, retouch B is essential. Significantly reducing the need for repeated retouch A sessions. Retouch B revolves two key elements, developing an eye to identify inadequately treated dots. Study photos closely, even magnify them 50 times, and practice identifying these areas with naked eyes. You can see these pointed dots near this retouch B. Repeatedly viewing example photos can be helpful. The skill to precisely apply pigment to these identified areas. Practice is crucial and it can be done on rubber pads. Ensure the needle stays in the skin for an appropriate duration during reapplication. During SMP, the needle continuously moves pigment within the skin. The longer it stays in the one place, the more pigment is deposited. Viscosity affects the rate of deposition. Proper margin RPM settings are also crucial. Too much time in one spot can lead to enlarged or blurred dots, while staying too briefly, less than 1 second, may result in inappropriate pigmentation. So, in summary, the key points are as follows. Scalp micropigmentation retouching involves retouch A and B. Developing the ability to identify and enhance undertreated area is essential. Proper needle movement and duration are critical for successful SMP research. Thank you.
Thank you very much, Dr. Lee. And our next speaker is Emma Furlong from United Kingdom, who is very passionate about SMP education with many years of experience.
Hello everyone, thank you for the invitation and thank you for having me here. So I'm going to speak about Think Before You Ink, safety in micropigmentation. It's vitally important that we treat SMP as seriously as we do surgery on our patients. We are breaking the skin and implanting pigment to make a significant change, sometimes for long term. So what is safety in micropigmentation? What are the areas that we need to think about? Infection control protocols, using safe needles, health and safety, working safely under proper trained conditions. So the pigments and inks, we have two different types of pigment that we use. Typically the longer lasting pigment is more well known, but we also have shorter term pigments. Both have different benefits in the skin and for different patients. We have also evolved in our practice to be able to offer both in combination. Either product needs to be a safe product, so it must be produced specifically for SMP. Not a tattoo pigment, not an eyebrow pigment, not a microblading pigment, an SMP pigment. It must be manufactured and packaged in a sterile environment, not in a garage, and it must be manufactured and clinical trialed for biocompatibility. Patch tests must also be carried out for SMP. Some insurance companies will allow 2 hours, but most it's 24 hours prior to treatment. Needles, what constitutes a safe needle? Sealed unit, no backflow. Again, sterile manufacture and packaging and traceable production. Could you spot the fakes? All of these products were ordered from the internet by us, seemingly safe SMP needles. All of them are fake. A correctly packaged needle will have the cartridge number positioned within the bulk of the material, not at the top. It will say it's a safety cartridge. It will have a full traceable sterile unit number and also an expiry date which doesn't correlate to 20 years' time. Safe needles, this is a good depiction of these two needles. Again, could you spot the fake if you receive this needle? We do have pointers that we can look for, namely the membrane and also biocompatibility. So that's just a little look. We know we have lots of different effects that we're looking to achieve, but our needle must be safe to achieve them. Devices, there's lots of devices out there now available, which is great because it suits multiple needs, multiple practices. In the UK, we have to have CE marking. Electronic devices must be safe. Again, these must be micropigmentation devices, not tattoo devices. We're very fortunate in the UK. We don't have regulation in SMP. It's not a regulated industry yet. We're lucky enough to have BARS, who has regulations for us to become members and follow. What happens when it's not safe? Well, infection, poor healed results, unsuitable colour development, and the last thing that we want is to have a fantastic treatment but cause somebody inflammation. It's not worth saving a few pounds on unsafe needles when you could damage somebody's skin. So this is both safe SMP and SMP that's been properly carried out. Beautiful results, helping patients with hair loss in safe conditions. Thank you for listening.
Thank you very much, Emma. And now we're going to start the question and comments section. Please introduce yourself before asking the question and limit your question to 1 minute.
So could I just ask for a show of hands in the room for how many people either do SMP themselves, have an SMP person in their clinic, or work closely with somebody who does SMP? Okay. So I don't do SMP myself, and I ask the question, I work with a team who do SMP, and I ask this question over and over again, and I'm sorry I keep forgetting the answer, but can the panel or one of the panel remind us what's the difference between organic and inorganic pigments, and when would you choose one or the other? And tied up with that is, does hair color impact on that? So if you're going to do SMP, say, would you do SMP on a red-haired person? If so, do you have to choose what pigment type you use?
So, is that working? Can you hear me? Okay. So, yes, we have organic and inorganic pigments. 95% of treatments are requested with the longer-lasting pigment, which is purely carbon-based, which is completely organic. But we do have inorganic pigments in the shorter-term ranges. They still have organic components, so we don't have fully inorganic, and that is because of the colour development and the way that the pigments are manufactured. So we do have two different types of pigment. Inorganic and organic in terms of pigments is not the same as food groups or pharmaceuticals. It's very different. It's the type of pigment that's used. All pigments are synthetically manufactured. So the inorganic and organic components is the component that will make the colour stay in the skin. And yes, we do have different tones. So the longer lasting pigment is grey-based carbon. So that we dilute that down, you stay on a grey scale. For warmer toned, lighter toned skins, that's when we would use a more inorganic product, because we have the other synthetic colour components which disperse in the skin differently. So we are able to add tone, but it's still carbon-based, so it will still heal down grey rather than red, orange, yellow, blue, green or brown. It will still feel down like a follicle, hair follicle pigment tone. So SMP pigments are very specific to SMP treatments. Like I said, they're not eyebrow pigments. They're made very differently to heal effectively on the skin.
Thank you very much. Microphone 1, Dr. Wasserbauer. I'm sorry, Dr. Devro.
Sorry. Do you have any explanation about the fact that the black color is becoming blue? For years, I tried to find the solution, and I had many explanations, but it's still the same problem. We try many different ink, and it's almost always the same thing. After a few months or a few years, it's becoming blue. And I don't know if there is a solution, if it's possible to avoid it.
We
hear that quite often, and quite often it is because the treatment is being done with a black pigment made from a blue base. So for SMP, the base that we use is grey. As explained, we wash it's a grey base colour, so it will ash rather than go blue. And sometimes it's about the depth of implantation. Too deep can put a blue hue to the colour.
But what is the explanation? Why it's becoming blue?
This primarily is a physical explanation to it. It's known as the Tyndall effect. Basically, it is the commonly seen with iron oxide pigments and less so with carbon, but it can occur with both. And there is selective absorption of all other colors except green and blue. So the black pigment appears as green and blue. And that is what the solution is, to use a more gray shade of the pigment rather than using a pure black pigment.
But what is the difference between the gray ink and the black ink?
The shade, the ingredients change the color. The final deposit of color will be different. Like you have a gray wash series, so you have different shades of gray in that. So the change of color that happens with black is not is more pronounced than what happens with gray.
Okay.
When you buy your ink that you choose to use, you should be given, or you can request to ask for a material safety data sheet, which will list all of the ingredients in there, so you would be able to read and understand the actual colour you're using, whether it's a grey-based black or a blue-based black. So it will be on the material safety data sheet from your manufacturer.
Sometimes, even after the base is grey and the carbon is mainly used, the reason why you see your veins green under the skin, though the blood is red, sometimes this Tyndall effect, and this can explain a little bit of variation in color.
Okay, thank you.
Thank you. The question goes to Dr. Sarah.
Hi, Sarah Wasserbar from the United States. I love that you just mentioned the ingredients in the MS, the data sheets. We're required to have them, but in the United States, manufacturers are not required, I think you guys taught me this, manufacturers are not required to disclose their ingredients. And there has been an absolute explosion of scalp micropigmentation artists who are very good, who have decided that they need their own brand. And they come up with a pigment. They've come up with some really odd ones, some hemp-based, or but you don't know what's in them, and there's no way of finding out. If you were to put one through, a chemical testing agency, like gas chromatography or something like that, what specific ingredients would you be looking for that would be undesirable in a scalp micropigmentation pigment? What would be like your top 2 or 3?
So ideally, we're looking for certain types of carbon, but it's not always that the ingredients are, carcinogenics for one can be contained. It's not always that it's an ingredient that shouldn't be in there. It can be the composition and the mix of the pigments. So we found through various methods of testing that changing the carrier, so all pigments start as a powder. Every pigment starts as a powder, and that powder form has to be then diluted. So it's diluted in a carrier, like the vehicle to carry the pigment into the skin to park it up. So we need that carrier to contain certain elements. It has to have a sterility format to it, so there's usually alcohol. But if you have too much isopropyl alcohol in the carrier, it will affect how the pigment will retain and hold. Similar, some people have been putting, like you say, hemp, tea tree. They haven't tested how that affects the base carbon uptake in the skin. So, we read all of these, anti-inflammatory, you've got tea tree in it. Okay, but what's that going to do to the pigment powder? So, yes, there are products in there that shouldn't be, i.e. carcinogenics, other products that can cause inflammation and irritation, but it's more down to the correlation between the pigment and the carriers, and then those extras that are put in.
So there wouldn't be any particular thing that you're looking for. It's just that the unknown ingredients that people are mixing in are entering or injecting a big question mark into your treatment.
Yeah, absolutely, and it's a problem that we face trying to, there's a lot, like you say, there is the SMP industry is growing, and that's fantastic to reach more people affected by hair loss, but we're also encountering more products that maybe we can't find, even in other countries, not just the US, there is a small percentage that they can have undisclosed, secret ingredients. And that can throw up the issues. If it's a tiny percentage, then we can work with it. In Europe, we have REACH compliance, which has banned a whole host of pigments, so the actual powder base, and some of the additives that were going into the pigments. So we can't buy anything from the US anymore in Europe because they're all non-compliant. So our market has emerged and evolved to the EU REACH compliance, which is great for safety, but it has thrown up this quandary of all these artists that have been using these products that turn blue because, the mix is wrong. So your dilutant has to be different, because that's also another component. There's so many layers to SMP before you even put the needle in the skin. But pigment is a big one. So just buy EU REACH compliant pigments and you're all good.
Okay, thank you. Microphone 2.
Hello, my name is Dr. Seema Garg from India. My question is how to prepare the scalp for the SMP, and what post-SMP instructions we shall give to the patients.
So ma'am, we should see what type of scalp the patient has, whether it is oily, whether it's normal scalp, or it is dry, it may be flaky. So the scalp should be normal. So before we start inking, we have to ask the patient if it is oily, he or she has to shampoo it regularly and maybe apply some astringent so that less oil is secreted when we start doing the SMP. If it is very dry or flaky, it has to be oiled and shampooed before. So in a nutshell, the skin has to be healthy. The scalp has to be healthy before we start the first time procedure. Then post SMP, according to the number of days, like he shouldn't wash the hair for first 4-5 days, then next day they can wash by water, and then they can shampoo regularly as per their own schedule. The second session would be at least 15 days to 1 month interval from the first session, so that the area is healed properly. They should not pick the scabs, if any. Then heavy gymming should not be there at least 15 days. So all this we put in a sheet and we give it to the patient as post SMP sheet.
Thank you.
Thank you.
Microphone 1.
Bob Haber, what do you tell your patients when they say, but doctor, what will the SMP look like when I go gray?
So it's a really common question, and it's a great question to ask. So we talk a lot in our educational program about future-proofing. I think my students just get sick of me saying the words, but it's so imperative to a successful long-term treatment. Future-proofing will allow us to determine what shade we should use. So we will do a full assessment in consultation on how old the patient is, whether they dye their hair, what their hair loss prognosis is, so we can determine what are we going to be doing with this pigment. Are we going to have to go lighter than what our patient needs now because it's going to fade on the grey scale? Or are we going to have to use a shorter term pigment in combination with a long-lasting base that's light? So when that pigment fades out, we still have that longer term base on a lighter grey scale. So we will use a combination of measures to future-proof our treatment, whether that's various different sessions, more multiple sessions with different types of pigment, or going lighter on that grey scale. And then you have the patient who tells you that on her deathbed, her daughter will be dyeing her hair, so we don't need to worry about grey.
Thank you.
Thank you. Microphone 2.
Hi, Dr. Heng from Singapore. I would like to ask the panel, because I don't see much international guidelines on SMP, in particular for people with possible ink allergies. I saw that you mentioned patch testing. Can you talk me through how a patch test is normally done, number one? And I do know that certain tattoo artists, they do patch tests. On top of that, they scratch the stratum corneum to make sure that the ink has a little bit of a penetration. So is that normally done? Or if so, how is it done by you guys?
Patch testing is something that not everyone does routinely. I do it. Primarily, the allergic response to a pigment is type 4 delayed hypersensitivity, which comes up much later. It can come up any time in the lifetime. But there is also probability that you may have an immediate hypersensitivity. So doing a patch test about 48 hours just rules out that part of the issue. But in spite of that, the patient may still have an allergic response later on during any time during his lifetime.
One thing I came across several years ago, yes, we all patch test prior to procedure. But when we see somebody else who's already had SMP, sometimes do you patch test again? And yes, you do. So because we've seen secondary patch tests where the pigment is a safe, stable pigment and you patch test behind one ear with the new color. But if you put that into the skin on somebody who's had a layer of pigment before and you put another color on top, they could have what's called a secondary reaction. So patch testing in a new site rather than on a scalp is also a very good idea.
I see. Thank you.
Thank you. Microphone 1.
Hi, I'd like to know if anyone knows about a pattern like topic, like camouflage, vegetal, instead of little dots as we use on SMP, because little dots simulate the scalp, the shaved scalp, and sometimes it appears unnatural. Do you know something of this kind of technique?
Yes, I work in skin tone, so as well as adding follicular dots to a scar or a scalp, I also work in creating camouflage on a skin to blend in. So it is possible that you could, if you had a large area to camouflage, that you can use specially mixed colors for the skin, but bearing in mind that they will alter and change. So rather than just putting one color that you mix accordingly, you need to put a blend of maybe 3 or 4 colors into the color, and you implant in 2 different types of technique. When you add skin color, you can implant in what's called a mosaic technique, where you would choose several colors and make like a skin tone spot mottled effect, or you can dilute the pigment and make a color wash. And that works well in a split scar, and then later you can camouflage into it. But if you start adding long-lasting skin tones, it's a great answer, but over time it minimizes the accepted effect. So it's possible, and but it's quite a complicated mix to get a good result. We're seeing it a lot in a completely different field, in people wanting to camouflage stretch marks, and they're turning into human zebras. It's all about knowing how to color the skin correctly with the right product, but it's possible.
Thank you.
Microphone 2.
Hi, I'm Dr. Ruchi from Delhi. My question is that how do you manage to retouch the same points when we are doing a retouch? How do we manage to retouch the same points at which the SMP was done originally? And for how long can we, for how long have you followed up a patient of SMP? Like how many times can we do an SMP for a patient? For how long? For how many years?
Yeah, Dr. Ruchi, so when we do a second session for a patient, usually we do not retouch the same points. If you think the ink has lightened very much, only then you will retouch. Otherwise, you will add to the density of dots you have already created, because you need to bring the distance between 2 dots less, but still scalp should be visible between the dots, and then comes the beauty of SMP, that SMP should not come out. It should not stand beyond the hairs. And the second question was how often we need to do again. So 2 or 3 sessions at least.
Like if I'm doing it in 2023, if I'm doing it in 2023, can I expect that the patient will be having the effect of SMP in 2033, or like for how many years? Like 20 years, 10 years, for how long?
So 3 to 5 years we usually say, sometimes 8 years. It depends upon how much the exposure to sun is there and the other chemical exposures. But we also tell the patients, whenever you feel it has started fading, you can come back and then we can assess.
What is the longest follow-up of any of the panelists of SMP?
8 years.
So the pigment will actually remain in the skin indefinitely. The particles actually disperse, so the colour, thanks to the Tyndall effect, thanks to the fact that they're UV susceptible, will fade down. Depending on the type of pigment you have used and where it's placed in the skin will determine how long it's going to last. The longer lasting carbon-based pigments, 2 to 5 years we say before a retouch is required, but that pigment in some of my older clients is still visible 11, 12 years on. It's just very light. So depending on how we're future-proofing and how we want that pigment to look will depend when we're going to retouch. The shorter-term pigments, the immune system eats them up and takes them away much quicker, so they actually last up to 12 months with visibility and need retouching from 9 months onwards. So it depends on the type of pigment, but it can remain for a considerable amount of time.
Just to ask that question again, though, in terms of your personal longest standing patient with kind of modern techniques, would you say 10 years you've had?
And one other point is once SMP is in the scalp and healed, it's really, really important to use a sunblock to maintain the color and obviously the scalp.
I think to Bob Haber's point earlier, I think much like the epidemic of catastrophes we're going to be seeing in the next 10 years with incorrectly done FUE, and it's going to be a tsunami of patients. I think we'll be having the same thing with SMP. And unfortunately, well, they're both going to be difficult to fix. My question for the panel, if each of you could just briefly respond what advice you give to patients in how long after you do SMP would you recommend they have a hair transplant, and vice versa, how long after having a hair transplant would you recommend them having SMP? Just a quick answer from each of you.
Basically, I would wait for a full year before doing SMP after a hair transplant, and at least a few months before the SMP has completely healed to then plan a transplant. But after a transplant, if SMP has to be done, I think till you see the full outcome of your transplant, you shouldn't be inking the patient.
Actually, I agree with completely that. And so on the combination side, if you can plan in your treatment process for patient satisfaction that if they need SMP, it may be that they have a light SMP section first, and then they'll get the benefit after their transplant of SMP, because yes, they have to wait a long time for any touching up and filling in by SMP.
Microphone 1.
Thank you. Gary Raj from New Zealand. Are there any guidelines for actinopaths, so particularly males with a lot of actinic damage? Thank you. And these are clients that might need Efudix and that might blur the pigment. But do you have any reservations for using skin micropigmentation for people that have had 5 melanomas on their scalp for delayed diagnosis risk? And also, if you're using Efudix or skin cancer treatment to these patients, it's of course going to blur all the pigment and give the aesthetic effect quite poor. So do you steer patients that have a lot of skin cancer away from skin micropigmentation because of a risk of a delayed diagnosis?
We treat every patient independently. If people have been experiencing skin cancers, then we would look at the treatment plan. We wouldn't be doing any SMP until all treatment's been received and fully healed, so 6 to 12 months post-surgery. We would look at a lot of our technicians are trained in looking at and assessing skin cancers. So we will be looking at, okay, have we got any progression here? I wouldn't say that I've turned anybody away. I've maybe just delayed a treatment plan and looked at the different options. We don't treat over moles. We don't work over them, we work around them. So we're not actually going to be changing the composition of any lesions.
Okay. And the next. Oh.
Just a continuation on that question, though. There is some pigment uptake by macrophages, isn't there? And drift potentially towards regional lymph nodes. Have you had, any of you had any experience with a patient having a lymph node biopsy where there's been darkening of the lymph node from SMP pigment?
We haven't had a
No, I haven't had that for SMP. I have had patients that have come to me that have had tattoos, and namely one specific type of brand, which was a red pigment that showed up, and she ended up having invasive surgery for potential cancer, and when they biopsied, it was actually tattoo pigment. But no, nothing from the SMP side.
And the next question for panel. As physician, we need to know our limitations. So what skin conditions would disqualify a patient from getting SMP treatment? What skin conditions will disqualify patients from getting an SMP treatment?
So any skin condition in which the epidermis is breached, there are lesions, we think there is a pathology which needs to be treated. The scalp should be healthy before we start SMP. No inflammation.
And to follow on this question, patients with active autoimmune alopecias, are you going to do an SMP treatment?
So,
basically, if you deem a condition active, obviously camouflage will not be done at that time. Only you have your dermatologist certifying that the patient is in remission. That is when you would attempt to do some kind of a cosmetic cover-up for him. Or her.
Any advice for how long the patient needs to be in remission?
We have to work with our governmental standards in our industry in the UK, and we have a guideline of, they state 7 years, where an area of an autoimmune like a vitiligo has not moved or seen a significant difference or change.
Thank you. Question for Dr. Saraswat. When would you consider using laser to help with the removal of botched SMP?
So if we have a patient with botched SMP, which looks very abnormal, so the SMP should actually make the scalp look fuller. The cosmetic effect should be of fuller hair. If the SMP stands out and it shows that there is a blotching, blackness on the scalp, it needs to be removed first before we start the better, smaller dots. So Q-switch laser is a very good tool with us, and Q-switch laser usually requires around 2 sessions, 2 to 3 sessions to remove it, and then better SMP can be done.
Thank you. Next question for the panel. Are there any differences in your approach to treat FUT versus FUE scarring?
The premise of SMP is to get a consistent finish to a patient's scalp. So any approach is blending a scar, whether that's FUT or FUE. FUT, we are concentrating density in the area where there is no hair, if it's been a trichophytic closure, where there is some hairs, and then we are blending through. So that can be, with somebody with high follicular groupings, high density, we may be doing the scar and blending, millimeters. On other scalps, we may be blending through 3-4 centimeters on either side of the scar. FUE, we're looking to blend the density that they have in the fuller area so that it's consistent through the back, unless now we're getting more artistic recommendations for skin fades and, you know, hairstyles with the SMP, which is just a whole other ballgame.
I tend to speak that very simplistically to patients, that SMP is a fantastic answer, but if you have FUE, FUT scarring in the area, there needs to be a pre-treatment where you need to treat the scar before you add colour, because if you have a smoother canvas, you're going to get a better implantation of, you get a better effect. So in other words, a smooth canvas rather than the scars or any ridges. So we have a treatment plan where we have special needles actually that will soften and flatten the skin as well as hydrate the scar so that you have your perfect canvas. I put it very simply to them that if you were buying a new house, you wouldn't just go in and decorate a room, you'd prepare the walls before you put your colour on the wall. And SMP to me is very similar to that.
Thank you. Microphone 1.
Yeah, just a follow-up question for Dr. Saraswat on the previous question. If you're removing dark pigment in an area where there is hair with the Q switch, is there any risk to damaging the pigmented hair in doing that?
Yeah, so there is a temporary whitening of the hair in that area, but the pigment in the hair tends to come back within a month or so.
Dr. Lee, the next question is that while doing the retouching option B, how often could you help, what you could do to reduce the number of sessions to achieve the final look? You talked about the options.
If I do retouch B properly, and then I think I need retouch A 2 or 3 sessions. But if I don't do retouch B for fulfilling the every area, every touch with pigment, and then sometimes I need more sessions, like 4 or 5 sessions for retouch as retouch A.
And like your older patients, how often are they coming for the retouch, as somebody asked in the audience? Do you get patients who are coming for the retouching of the SMPs?
Usually I do retouch one time after the initial session. And I think one retouch session will be enough if I do it right at the first session. And the second session will be from 2 to 4 weeks later from the initial session.
Question for the panel. With a plethora of different inks and pigments, how important is allergy testing before you start your procedure?
Can you hear me? We touched on this earlier. Allergy testing is really important. And it's not only the fact that we need to test against the allergens in the pigment, but it's also the needles. Some people, particularly if somebody reports that they have a nickel allergy, the needles do contain nickel as a setting agent. So in the UK, we have to allergy test up, we have to patch test every patient that we see, and we use needle and pigment to do a few dots in an area of density. We trace it and track it so that we can check that. And we can do it with the scratch method, but you need to implant the pigment into the skin. And it's not the same in every country, but we would recommend it.
Can I ask a question to Emma? Basically, you mentioned about pigment specific for SMP. Let us say there's a tattoo pigment which is carbon-based. How does it differ from the SMP pigment, that is something that has been made specifically for SMP? What are the attributes of that pigment?
So the type of carbon is one of the biggest attributes. There is a couple of specific grey-based carbons which have been synthetically manufactured for SMP. So no blues, greens, blues-based, reds, even purples we used to see in the early days that are made for tattoo artistry. And also the carriers. Like I said, the carriers are very important because we're not going as deep as regular tattoos. We're not sitting down low in the dermis, we're sitting up in the capillary dermis. So we want that carrier to get the best vehicle to get the pigment in. There's lots of other pigments which used to have before REACH compliance came in, carcinogenics and different products. So the SMP industry have stayed away from those. It's predominantly your carrier, the vehicle, and the type of pigment, the pigment code. The particle size is determined, the carbon particle size, the iron oxides, yeah, so that's the two different types. That's your molecular weight will change with one type of pigment rather than the actual ingredients of the pigment.
Emma, just a question. When would you use a tri-cannulated versus a unicannulated needle during SMP?
So I only use single-use needles that I use, and I dip the pigment, the needle into the pigment pot. I don't use a cannula with my needles. Was that the question?
No.
Oh, okay. So a 3 configuration versus a 1.
Yeah.
So I only predominantly use three needles, and the reason is those needles are of the same aperture of a lot of the single diameters, but they're fused together to a really fine point with a long taper, which again is how the pigment carries down the needle shaft and goes into the skin, different from a regular tattoo needle. So it will sit in the skin. The 3 needles is the advantage of your better retention and less migration. You're causing less trauma with a 3 because you have more tension from the skin, and also you have 3 channels of pigment going into your single impression, which will then soften and migrate together rather than 1, which causes more trauma. You get less retention. The needle, the spread will go out rather than internal on the healed result. Only if you really need super, super, super fine dots would you use a single.
Also, if you look at your needle under a microscope, a needle isn't necessarily smooth. It can be rough to allow the pigment to adhere to the needle. So for a single needle, you have to have a more consistent pigment to adhere to the needle. A 3 sometimes get a small trap, but on the semi-permanent, the lighter weight colors, you can use a needle with a chamber because it's a thicker consistency, and so you can implant much longer, like 5 times longer, without needing to pick up, because you can put a thicker needle, a thicker serum or pigment into the reservoir. But for SMP, we normally use the water-based carbons, so we're back to dipping, but with usually the 3 needle.
Thank you. Thank you very much, faculty members, for such an informative session. I hope it's going to help to treat our patient better and avoid costly mistakes. Please vacate the space for the next session preparation, which will start at 2 p.m.